Hi, I'm Jill with Angelus Therapeutic Services. In working with children over the last 20 years, I have seen a lot of kids and families who are struggling with how to connect, manage behaviors, and develop routines and relationships that allow them to flourish and enjoy time with each other. Although this population can be challenging, I very much enjoy it because there is so much growing and progress that can be made. One of the ways to treat these challenges in therapy is called PCIT, which stands for Parent-Child Interaction Therapy. PCIT is used to help with families with children ages 3 to 7 who may be struggling with losing focus easily, being defiant, not following instructions, children who may appear to have attachment issues, they can be aggressive, struggles with getting along with their siblings. PCIT is what is called an evidence-based practice, which means it is very well tested, used, and regulated with a full training process that ensures the therapist is experienced and well-versed in helping families heal. There is a year-long process to become certified, which I have fully completed. PCIT is hands-on. The parents get to enjoy the experience of working with their child in a healthy and positive play environment. The therapist will assist the parents in completing the therapy with their child. This is used to build a more secure attachment with the primary caregiver and to help that caregiver learn healthy and consistent discipline for when things get a little rocky. This is done both with the parent and the child present. I, as a therapist, takes on an observer role and coaches the parent on how to use play therapy to build a more warm and nurturing relationship, which can understandably have become difficult over time, as children may have experienced different traumas, struggles, and delays in their lives. PCIT can be done in as little as 12 weeks. It's split into 2 sections of learning. The first 6 weeks are child-directed interactions, which means the parent follows the child's lead in play and uses positive social skills to build a secure attachment. The second 6 weeks are parent-directed interactions, meaning the parent will learn to give and use effective commands, as well as have a tried and true discipline technique that they can use anywhere. The therapist is able to be very discreet in their coaching by allowing the child and caretaker to be in the play space together, with myself in another space observing through video and being able to make suggestions to the parent through an earpiece, thus ensuring that the child sees their adult caregiver as the lead in the process. As can be imagined, nothing can be changed in a family simply from coming to a PCIT session once a week and only trying these techniques in that space. As part of this therapy, there is an important and required 5 minutes of homework each day to help the parent and child learn and reinforce these skills. Over the course of time, a decrease in negative behaviors is measured from a simple check-in assessment each week. This helps the family and therapist gauge where focus and further fine-tuning may be needed. At the end of the PCIT process, our goal is for increased positive attachment and connections between the child and their primary caregivers, an increase in positive attention span at home and in school, families to be able to have more positive and relaxed interactions, decrease anxiety about going to the store with your kid or into social scenarios which may have previously triggered meltdowns, and helping your child to truly alter their behaviors so that they can have quality social relationships with family and friends. I understand that this was a lot to go over, but I would be happy to explore with you how this or other types of treatment may be able to help move your family from stressed and struggling to feeling connected and calm.